So if we look at the reality of modern referrals, speed really determines outcomes these days. Volume, the number of referrals where discharging hospitals are sending them out to anyone who can potentially receive a patient, means that speed is the name of the game now. If you respond slowly to a referral, you have a much decreased opportunity to admit that patient if they match your facility. So speed is determining the outcomes of whether you are able to admit that patient. The second piece is that due to that high level of volume, where on a patient packet basis, we have anywhere from 20 to 200 to 300 pages per patient, teams have to manually review that patient packet to determine, hey, does this patient meet our facility's admission criteria or not? The intake teams can't keep up with that growing referral flow. Staffing alone can't scale with that overall review capacity. On top of that, if we don't do a great job of reviewing that patient packet, then we potentially are admitting the wrong patients, which leads to denials or cost overruns or lost margin, or potentially a patient that's actually clinically not a good fit for that facility, which creates operational risk, staff burnout, huge issues for the facility if they're getting the wrong types of patients. So identifying the right patient protects reserves bed capacity. So when we look at what these referrals and patient packets actually look like, every referral really requires careful review. And we see, again, 20, 30, 100, 300 pages per referral. They're scanned, they're faxed, there's handwriting, potentially low quality PDFs, handwritten notes, there's clinical history mixed with administrative data, there's behavioral information, medication, payer details. And so how do you quickly and effectively review these patient packets against your admissions criteria? That's what's taking so long, and in a competitive environment is super, super tough to do well. In addition, it's expensive. If we're spending 30 minutes per referral, oftentimes these are clinicians who really should be working at the top of their license, but are having to do these administrative tasks where each referral can be $30 or more just to review the documents. And what we see is for even mid-sized health systems, that's $2 to $4 million annually in costs just to review referrals. And so super excited to introduce this group to Basalt. What we do is we automate these back office workflows for admissions teams so they don't have to search through the hundreds of pages to make a decision. So what we do is we review all the patient documents. We surface the information the admission teams needs to know to make faster and more confident decisions. We read all 300 pages of the patient document. We compare that against the admission criteria. We can do that for any and all facilities, even where there's variability on a per facility basis. We flag any red, yellow, or green criteria where that patient maybe doesn't meet the facility criteria. A great example is, let's take for long-term care facilities, if the patient actually meets more of a hospice designation or is on hemodynamic monitoring, or in the BH space, if a patient has continuous oxygen dependency, or if they have recent aggressive behavior. We surface and identify that information so your teams can run really quickly and make a determination.